Hello everyone, Dr. Alan Mandell here. Welcome back to my channel, Science of Healing. Did you know that after the age of 70, some of the routine health checkups doctors recommend might actually do more harm than good? Yes, the very tests we trust to keep us safe could be silently putting us at risk, causing stress, unnecessary treatments, and even life-threatening complications. Today, I'm going to reveal 5 health checkups you should think twice about after 70, backed by science, and I'll explain safer alternatives to protect your health naturally and wisely. Stay with me, because this information could save you from unnecessary pain, anxiety, and even medical mistakes. Did you know that one of the most common tests men undergo after the age of 70 could actually do more harm than good? The PSA test, hailed for decades as the guardian against prostate cancer, might be quietly setting off a chain reaction of unnecessary procedures that can devastate a man's quality of life. Imagine sitting in a doctor's office hoping for reassurance, only to be told your PSA level is high and that you need a biopsy immediately. That moment, which feels like a lifeline, can spiral into weeks of anxiety, invasive surgery, and irreversible side effects, all for a cancer that may never have harmed you in the first place. Prostate cancer is often a slow-growing disease. In fact, studies show that many men over 70 who are diagnosed with prostate cancer would never experience symptoms or life-threatening complications in their lifetime. The New England Journal of Medicine published a study revealing that nearly half of men over 70 who underwent PSA screening ended up receiving treatments they did not need, suffering from incontinence, erectile dysfunction, or complications from radiation therapy. This isn't just a statistic. It's real men losing independence, confidence, and intimacy because a test designed to protect them triggered interventions that were unnecessary. The PSA, or prostate-specific antigen test, measures a protein produced by the prostate gland. A high reading raises alarms, but here's the hidden truth. PSA is not a perfect marker. In older men, PSA levels can rise naturally due to benign conditions like an enlarged prostate or inflammation, which are not life-threatening. Yet, when these numbers show up on a lab report, doctors often respond aggressively. Biopsies follow, sometimes multiple, each carrying a risk of infection, bleeding, and hospital visits. Radiation and surgery might be recommended, leaving men with side effects they were never prepared for. Even more shocking, a study conducted by the Journal of the American Medical Association found that routine PSA screening after 70 provides minimal benefit in terms of prolonging life. In other words, countless seniors undergo the stress and physical trauma of unnecessary treatments, chasing a number that may have never mattered. The irony is painful. We think we are protecting ourselves, but in reality, we might be exposing ourselves to harm. It gets worse. The psychological toll of a high PSA reading can be devastating. Anxiety spikes, sleep is disrupted, and every twinge or discomfort becomes a source of fear. Men report feeling constantly on edge, fearing that their life is on a ticking clock. This chronic stress doesn't just affect mental health. Research shows it can impair immunity, increase inflammation, and worsen overall health. In a way, the test meant to save lives can rob a man of his peace, vitality, and joy. And so, what is the alternative? How do men protect themselves without falling into this trap? The answer lies in shifting focus from blind testing to informed, personalized health strategies. First, understanding your risk factors is critical. Family history, genetics, lifestyle, and existing medical conditions should guide any testing decisions. Second, monitoring changes in urinary habits, sexual function, and overall health can provide meaningful insight far more useful than a single number on a lab report. Nutrition plays a surprisingly powerful role. Studies have shown that foods rich in lycopene, zinc, and antioxidants like tomatoes, pumpkin seeds, watermelon, and berries can support prostate health naturally. Regular physical activity, maintaining a healthy weight, and reducing chronic inflammation through a diet low in processed foods are simple, safe, and effective ways to protect the prostate without exposing oneself to unnecessary procedures. These lifestyle choices are empowering because they are fully under your control, unlike a lab result that triggers a cascade of interventions. The story becomes even more compelling when we consider that overdiagnosis and overtreatment are not isolated problems. In countries with widespread PSA screening, a significant proportion of prostate cancers detected in men over 70 would never have caused harm. Yet the fear of cancer detection fuels a medical system designed to act aggressively, often at the expense of the patient's quality of life. It's a paradox. We have more technology, more tests, and more treatments than ever before. Yet this abundance sometimes undermines the very thing it promises: longer, healthier lives. The decision to undergo a PSA test after 70 is not trivial. It is a decision that must be weighed carefully, balancing the potential benefits with the real risks. The best approach is a shared, informed discussion with a healthcare provider who understands the nuances of aging, disease progression, and individual risk. Blindly following guidelines without considering personal context can lead to outcomes far worse than the disease itself. Men over 70, it's crucial to remember this. Cancer is not always immediate danger. The statistics are sobering. Nearly 50% of prostate cancers detected in older men grow so slowly that the patient is more likely to die of other causes than from the cancer itself. This isn't fear-mongering, it's scientific reality. And yet the medical system's default response is intervention. Biopsies, surgery, and radiation, all potentially unnecessary, become the norm. Understanding this reality allows men to reclaim control over their health, choosing caution, lifestyle optimization, and careful monitoring over reflexive medical procedures. Imagine a world where seniors are empowered to make informed choices, where PSA testing is used selectively, and where lifestyle interventions, anti-inflammatory diets, regular exercise, stress management, take precedence over invasive procedures. Imagine men enjoying their golden years with vitality, intimacy, and independence intact, rather than burdened by complications from tests meant to save them. This is not a dream. It is achievable, backed by decades of research and increasingly recognized by leading medical experts. The takeaway is clear: routine PSA testing after 70 is not universally beneficial. It can lead to unnecessary medical procedures, psychological stress, and a decline in quality of life. Instead, men should focus on risk-based testing, lifestyle strategies, and regular symptom monitoring. Foods like tomatoes, berries, and pumpkin seeds, combined with physical activity and stress reduction, can naturally protect prostate health. Informed decision-making, not fear-driven testing, is the key to living a full, healthy, and empowered life after 70. The next time you or a loved one sit in a doctor's office hearing about PSA screening, remember this: knowledge is power, and not every test is a lifeline. Some are traps. Choose wisely. Protect your body, protect your life, and most importantly, protect your peace of mind. After 70, many women continue to undergo routine mammograms, believing they are taking the smartest step to protect their health. It's an understandable belief. For decades, mammograms have been promoted as lifesavers, capable of detecting breast cancer early and offering hope in the face of fear. But here's the harsh, uncomfortable truth. After a certain age, these tests can do more harm than good, and the consequences are far more serious than many realize. The reality is that breast cancer behaves differently in older women. Many tumors detected after 70 grow slowly, sometimes so slowly that they would never cause symptoms in a woman's lifetime. Yet, when a mammogram lights up with an anomaly, it triggers a cascade of events: additional imaging, biopsies, surgery, radiation. Each step carries physical, emotional, and financial costs. It's not just an inconvenience, it's a series of medical interventions that can seriously diminish a woman's quality of life. A landmark study in JAMA Internal Medicine found that routine mammograms in women over 70 rarely extended life expectancy. Many detected cancers were slow-growing and would not have threatened the woman's life. Yet the majority of these women underwent surgery, radiation, and sometimes chemotherapy, often experiencing painful side effects, fatigue, scarring, and emotional trauma. This is not fear-mongering. It is documented evidence that the very test meant to save lives can, paradoxically, endanger the well-being of seniors. Think about it. An older woman goes in for a mammogram. She is reassured she is taking responsible action. But then the radiologist spots a small abnormality. Panic sets in. She is told a biopsy is necessary. The biopsy is painful, stressful, and carries a risk of infection. The results show cancer, and the doctor recommends surgery. She faces anesthesia at an age when complications are more likely. Her recovery is slow. Her independence may be compromised, and she may endure months of radiation or hormone therapy, all for a tumor that may never have affected her at all. The emotional toll is equally devastating. Anxiety, depression, and fear become constant companions. Sleep is disrupted. Daily life is overshadowed by worry and uncertainty. The simple act of living transforms into a life governed by lab results and imaging scans. This psychological burden, while invisible, has profound health implications. Chronic stress increases inflammation, weakens the immune system, and can exacerbate other conditions common in older adults. The test meant to give reassurance instead seeds fear. There is also the risk of overdiagnosis. Overdiagnosis occurs when a cancer is detected that would not have caused harm if left undiscovered. Studies show that in women over 70, a significant portion of cancers detected through routine mammograms fall into this category. Treatment of these cancers does not improve survival, yet exposes women to surgery, radiation, or chemotherapy, all of which carry risks of complications, infection, and long-term health problems. So what is the safer, smarter alternative? The first step is awareness and informed decision-making. After 70, mammograms should not be an automatic, routine procedure. Instead, women should evaluate their personal risk factors: family history, genetics, hormone therapy use, prior breast biopsies, and overall health. Women with no significant risk may benefit more from careful clinical observation, self-exams, and conversations with their healthcare provider than from routine imaging. Lifestyle also plays a critical role in maintaining breast health naturally. Nutrition, for example, can be a powerful ally. Foods rich in antioxidants, anti-inflammatory compounds, and phytonutrients, like cruciferous vegetables such as broccoli and kale, berries, green tea, and turmeric, support breast tissue health and reduce cancer risk. Maintaining a healthy weight and exercising regularly also lowers the risk of hormone-driven cancers. Simple daily practices, walking, resistance training, yoga, help regulate hormones, improve circulation, and boost overall immune function, all of which are protective for breast tissue. It's also important to recognize that listening to your body is often more valuable than routine imaging. Changes in breast texture, new lumps, nipple discharge, or persistent pain are significant signals that warrant medical attention. When tests are guided by real symptoms rather than by age alone, interventions are targeted, necessary, and much safer. Medical research increasingly supports this approach. The Cochrane database of systematic reviews examined mammography in women over 70 and found minimal benefit in routine screening, while highlighting significant risks from overdiagnosis and overtreatment. This isn't speculation. It's evidence that challenges long-standing assumptions about what good care looks like for older women. Imagine an alternative path. Instead of a routine mammogram that could lead to months of anxiety and invasive procedures, a woman focuses on nourishing her body, staying active, monitoring for symptoms, and making informed choices with her physician. She maintains independence, vitality, and quality of life. She avoids the trauma of unnecessary surgery, the fatigue of radiation, and the stress that can silently erode health. This is a vision of health that prioritizes life over numbers on a scan. And let's not forget the broader societal impact. Routine mammograms in older women contribute to rising healthcare costs and strain medical resources. Procedures, hospital stays, and treatments that may not improve outcomes use time, energy, and funds that could be redirected toward preventive care, lifestyle programs, and patient education. By understanding which tests truly add value, seniors and healthcare systems can focus on interventions that genuinely improve health and longevity. So, after 70, it's crucial to ask, do I really need this test, or am I following a routine out of habit and fear? The choice matters. Every decision about screening should be informed, personalized, and balanced against potential risks. Breast cancer awareness is vital, but awareness does not automatically mean routine screening. Knowledge, lifestyle, and vigilant self-monitoring are often far more protective. The takeaway is clear. Routine mammograms after 70 are not universally beneficial. They can lead to unnecessary stress, invasive procedures, and complications that may diminish a woman's quality of life. Instead, focus on risk-based screening, lifestyle interventions, symptom awareness, and informed discussions with your healthcare provider. Cruciferous vegetables, berries, green tea, weight management, and regular exercise are not just health advice. They are tools that empower women to protect their bodies naturally and safely. As you consider your health choices, remember this: every test carries a cost, every procedure carries a risk, and every decision matters. Protecting your health after 70 isn't about fear or following routine blindly. It's about making informed, intelligent choices, prioritizing quality of life, and listening to your body. Your health, your independence, and your peace of mind are far more precious than the reassurance of a scan that may not truly help. After 70, many adults consider full-body scans, the CT, MRI, or PET scan, as a kind of ultimate health insurance, a single image, a moment frozen in time, promising the reassurance that nothing is wrong. It feels safe, responsible, even smart. But here's the hidden, frightening truth. For many seniors, these scans can set off a cascade of events that do far more harm than good. What seems like protection can quickly become a trap. Full-body scans are extremely sensitive. They detect abnormalities, tiny spots, nodules, or lesions that the naked eye cannot see. That sounds good in theory. But in older adults, many of these anomalies are incidental findings, minor issues that would never have caused symptoms, pain, or risk in a lifetime. Yet when a scan reports something abnormal, the next steps often involve additional imaging, biopsies, and sometimes even surgery. Suddenly, what started as reassurance has become a months-long ordeal of fear, medical procedures, and emotional stress. The numbers are startling. Studies published in Radiology and the American Journal of Röntgenology show that in seniors, up to 30% of abnormalities detected on routine full-body scans are incidental. Most of them are harmless, yet nearly all trigger follow-up tests. These follow-ups are not benign. They carry real risks. Biopsies can cause infection or bleeding, MRIs with contrast can strain the kidneys, and radiation from repeated CT scans increases long-term cancer risk. For older adults whose resilience is naturally lower, these complications can be severe. Imagine this scenario. A 72-year-old man undergoes a full-body scan. The scan picks up a tiny spot on the lung. He is told he may have cancer. Anxiety overwhelms him. He undergoes a biopsy, which becomes infected. He is hospitalized. Weeks pass, his independence is compromised, and in the end, it turns out the spot was harmless, a shadow, a benign growth that would never have affected his health. That is not a rare story. It is a reality for thousands of seniors every year. The psychological impact is equally profound. Fear, anxiety, sleepless nights, and constant worry about every twinge of pain can consume someone's life. Studies in the Journal of the American Geriatric Society show that older adults subjected to incidental findings on scans experience higher rates of depression and stress-related illnesses. Stress is not just emotional, it is physiological. Chronic stress triggers inflammation, weakens immunity, and increases the risk of heart disease, stroke, and cognitive decline. The very scan that promised reassurance can accelerate the decline it was meant to prevent. Medical experts are raising alarms. The American College of Radiology and multiple clinical studies recommend against routine full-body scans in asymptomatic older adults. The risk of overdiagnosis, unnecessary treatment, and physical and emotional harm outweighs any potential benefit. Yet many seniors still request these scans, often encouraged by well-meaning but misinformed physicians or commercial imaging centers that promote early detection as a universal solution. One of the most insidious aspects of this phenomenon is the illusion of control. A full-body scan feels like empowerment. You're taking action. You're being proactive. But in reality, it can strip control away. An incidental finding can force medical decisions into your life, decisions you may not fully understand, involving invasive procedures, complex medications, and hospital visits. What began as a proactive choice becomes a loss of autonomy. So, what is the safer, smarter alternative? For seniors, medical testing should be symptom-driven, risk-based, and carefully considered. Full-body scans should be reserved for situations where symptoms exist: persistent pain, unexplained weight loss, shortness of breath, or other signs that a physician identifies as concerning. These scans are powerful tools, but their power must be used judiciously, or they become weapons of anxiety rather than protection. Lifestyle and preventive strategies offer far more meaningful protection than routine imaging. Maintaining cardiovascular health, engaging in regular exercise, consuming a nutrient-rich diet, staying hydrated, and monitoring key health markers like blood pressure, cholesterol, and blood sugar can dramatically reduce risk of serious disease without exposing seniors to the risks of incidental findings. Simple daily habits: walking, resistance training, Mediterranean-style eating, anti-inflammatory foods like leafy greens, berries, olive oil, and nuts support every organ system naturally and safely. It is also vital to practice vigilance without obsession. Paying attention to your body, noticing symptoms, and communicating them clearly to your healthcare provider is more effective than scanning every inch of the body when there are no signs of illness. Screening without symptoms often leads to chasing shadows, while symptom-driven care catches real problems early and addresses them meaningfully. The consequences of unnecessary full-body scans extend beyond the individual. They contribute to the rising costs of healthcare, occupy resources that could be directed toward preventive programs, and create ripple effects of stress and worry for families. The emotional burden on loved ones watching a senior endure unnecessary tests, hospitalizations, and procedures is profound. It is a cycle that could be broken simply by understanding when testing is necessary and when it is not. Medical research paints a clear picture. Routine full-body scans in asymptomatic seniors provide little benefit in terms of early detection of life-threatening disease, while significantly increasing the risk of harm. The statistics are sobering. Many of the findings that trigger medical intervention would never have caused illness, yet they lead to invasive procedures, hospital stays, and sometimes long-term complications. This is overdiagnosis, over-testing, and over-treatment in its starkest form. Imagine instead a world where seniors focus on empowerment through knowledge, healthy habits, and symptom awareness, where your doctor's office is a place for discussion, not panic, where you choose the tests that matter and avoid the ones that may steal your peace of mind and independence. This approach is not fear, it is science. It is evidence-based. It respects the reality of aging, the limitations of technology, and the value of living fully even after 70. The takeaway is simple. After 70, routine full-body scans in the absence of symptoms are rarely necessary and often harmful. They can lead to anxiety, unnecessary medical procedures, and a decline in quality of life. The smarter choice is risk-based testing, lifestyle interventions, and vigilant symptom monitoring. Walking, strength training, a nutrient-rich anti-inflammatory diet, and regular check-ins with a trusted physician protect health far more effectively than chasing every shadow on a scan. Your health, your independence, and your peace of mind are priceless. Protecting them doesn't come from scanning every inch of your body. It comes from understanding your risks, listening to your body, and making intelligent, informed choices. Routine full-body scans may feel like reassurance, but in reality, the true path to health after 70 lies in careful attention, informed decisions, and living a lifestyle that strengthens the body naturally, safely, and effectively. Every decision matters. Every test carries a risk. Every action shapes your life. After 70, choose wisely. Prioritize quality of life over fear. And remember, sometimes doing less is the most powerful form of care. Protect your body, protect your peace of mind, and embrace a path that keeps you strong, independent, and alive. Not stressed, overtreated, and confined to the hospital bed of unnecessary intervention.